were medieval barber-surgeons doctors or barbers. Imagine a time when your barber was also your surgeon. In medieval Europe, this was the reality. Barber-surgeons were a unique group who blended the roles of barbers and surgeons. However, they were not doctors in the traditional sense. They did not have the formal education that physicians received at universities. Instead, they were skilled tradesmen performing various medical tasks alongside grooming services. Physicians in medieval times were often university-educated and focused on theoretical medicine. They rarely performed surgeries, as this was seen as a lower-status craft. Surgery required manual skills and was often avoided by those with academic training. This is where barber-surgeons stepped in. They had the tools and dexterity needed for surgical tasks. Their responsibilities included bloodletting, pulling teeth, setting broken bones, lancing boils, and even amputating limbs. The practice of bloodletting was common, as it was believed to balance the body's humor. Barber-surgeons used sharp razors for this purpose, which is why they adopted the red and white striped pole as their symbol. The red represented blood, while the white stood for the bandages used in their work. Barber-surgeons first gained prominence in monasteries. Monks needed barbers to maintain their tonsure, a shaved patch on the head. Initially, monks performed minor medical tasks. However, as church decrees forbade them from shedding blood, barber-surgeons took over these duties. By the 12th and 13th centuries, they became the go-to practitioners for practical surgery outside the academic realm. Despite their essential role in healthcare, barber-surgeons were still seen as lower in status compared to university-trained physicians. They belonged to their own guilds and wore short robes, unlike the long robes of academic surgeons. It was not until the mid-eighteenth century that the professions of barber and surgeon were officially separated in England. In essence, medieval barber-surgeons were neither fully doctors nor just barbers. They occupied a middle ground, performing both grooming and surgical tasks. Their work was vital for daily life and health in medieval Europe. They treated wounds, performed surgeries, and helped maintain hygiene, even though they lacked the formal education of physicians.